Hello, Dr. Abraham. My name is Tariq Salem. I'm a second-year medical student. It's very nice to meet you today.
Nice to meet you too.
Okay. Before continuing, I'm just going to go ahead and wash my hands in the camera. So today I'm going to go ahead and do a musculoskeletal exam. Is that okay?
Sure.
Excellent. Okay, so I'm just going to go ahead and start just by taking some general observations. I'm just looking at the patient to see if she's in any distress or anything like that, and it looks to be good. We're going to begin by doing a shoulder inspection. I'm just going to go ahead and take a look at both of the shoulders. I'm going to assess anything for symmetry. I'm going to look for any swelling or any irregularities. I'm going to make sure to check the anterior side. And I'm also going to go ahead and check the posterior as well. I'm going to pay attention to the scapula, see if you see any signs of wing scapula, that everything looks good. So next I'm going to go ahead and I'm going to begin palpation. The purpose of this is to check for crepitus or any just irregularities. So I'm going to begin at the sternoclavicular joint, and I'm going to work my way up the clavicle. I'm just going to continue palpating, and then I'm going to palpate at the acromioclavicular joint, and then I'm also going to palpate the glenohumeral, and then I'm also going to palpate the bicep brachii tendon right here. And everything looks good. So now we're going to move on to the active range of motion portion of the exam. If you could, we'll just begin with abduction, which is just raising your arms up to your side like that.
Okay.
And then we'll do adduction, which is just bringing them down slowly. And then we'll go on to do flexion, which is raising your arms up like this. If you could do that just kind of above your head. Perfect. And then we're going to go down to extension, which is just putting your arms down to your side and kind of tucking them back a little bit. Okay. And then we're going to do internal rotation, which is just bringing your arms forward like this across your chest. And then we're going to go on to do external rotation, which is just externally rotating with your shoulders. Perfect. And just another note as well is that normally in an exam it'd be great to see just the skin for the different extremities, but in this exam we're just going to go ahead and continue forth with just clothing on. Okay, so now we're going to go and we're going to do the elbow next. We'll begin this by just examining the elbows. We're just paying attention for any swelling, nodules, irregularity, or asymmetry, and everything there looks to be good. We're going to pay close attention to the antecubital fossa on both sides, to the medial and lateral epicondyles, as well as the olecranon of the elbow. Okay, and so next we're going to go ahead and palpate, and I'm just going to do it on the left arm. We'll go ahead and begin by palpating with the arm in anatomical position. We'll palpate the lateral epicondyle. We will palpate the medial epicondyle, as well as the olecranon, which is good. And then on this arm, we'll also go ahead and palpate the radiocapitellar joint right here. Okay. So now, Dr. Abraham, we're going to go ahead and we're going to do some active range of motion as well. We're going to begin with flexion of the elbow, which is just holding it together. And then can you go ahead and push that out for extension? And then can you hold your hand out like this for supination? And then we'll go ahead and we'll turn them in to do pronation. Excellent. Thank you so much. And could you also do me a favor and stand up for just a moment?
Sure.
So one thing also as well on the examination of the elbow is to assess for carrying angle of the elbow. And that looks to be great. And you can just take a seat. Thank you. So now what we're going to go ahead and do is we're going to examine the wrists. I can take a look at the patient's right hand. We're just assessing for, once again, just any kind of redness, any swelling, any irregularities. We're going to check the palmar portion of the wrist as well as the dorsal portion, just to ensure that everything looks to be good. We'll also be sure to also check, both sides simultaneously, because that's where we'll check for symmetry. So now I think we'll go ahead and we'll begin with palpation. So I'm just going to begin by palpating the wrist right here. And then I'm going to go ahead and move on and palpate the metacarpophalangeal joints right here. And then the proximal interphalanges as well as the distal interphalanges. Thank you. And so during palpation, it's the same thing. We're testing for erythema, redness, warmth, just any kind of masses and things along those lines. Okay, so for our active range of motion, we're going to go ahead and begin. I'm just going to have you pull your wrists in like this for flexion, and then we'll go ahead and extend them out for extension. And then if you can hold them out, we will stick them out for radial deviation, and then inside for ulnar deviation. Thank you. And at the hands, we will just do flexion and extension. And then we'll go ahead and do abduction with your fingers, and then adduction. And then we'll go ahead and test opposition of both hands. If you can, just take your hands like this and take your thumb, and then just tap each finger. Great, thank you. Okay. And that will be the conclusion for the upper extremity, and we'll go on to the lower extremity. Dr. Abraham, I want to make a quick correction to one point during our recent hand physical exam. Is that okay if I go ahead and show you?
Sure.
Thank you. So during the wrist palpation, it's really important to ensure that you palpate the wrist, the metacarpal bones, which I forgot to mention previously, the metacarpophalangeal joint, as well as the phalanges, both proximal interphalanges and the distal interphalanges. And so next, in the active range of motion, it's also important to note that radial deviation is the internal deviation, which, if you wouldn't mind showing us. Radial deviation is internal, and then ulnar deviation is with the fingers pointing to the outside. Okay, perfect. Thank you.